80,000 series. Can everyone please come to 80,000 series? 8080. Okay, what do you mean by pathology? Okay, logy means study. First of all, whenever you will see logy, it means study. What do you mean by patho? Patho means?
Infection or disease.
Patho means disease actually. Right? Correct. So pathology and laboratory. Pathology means we are studying disease or cause of disease, if I say. If patient is coming with a fever, okay, complaining that he has fever from last 3 days, what doctor will say? Doctor will not give only paracetamol, right? Doctor saying if along with the fever patient have a some some other symptoms, okay, then doctor, if it is a good doctor, doctor must order one blood test just to find out what is a infection or if there is an infection, and based on that he can start antibiotics, right? If you are going for a self medication, then you can take any antibiotic, broad spectrum antibiotic, which will work for all the microorganisms mostly. But if it is a specific doctor, specialty doctor, definitely they will go only for the specific antibiotic, right? That is the concept. So to check what is the cause of a disease, we have gone through with the blood test, or we will go for the urine test. So any test just to find out the cause of a disease will be coming under pathology and laboratory. Okay, that is pathology and laboratory. So here you will see blood test, urine test, stool test, any other fluid test, tissue test. Okay, that also may be possibility that will do biopsy and will send to the pathology. Biopsy, you know, na? Biopsy is for any tissue. When we'll take tissue sample just to find out if there is cancer or not, and if it is a cancer, what is the type of a cancer, what is the stage of a cancer. If we want to really find it out, then we'll go for a biopsy. Okay, so biopsy will also be performed under the pathology. So this is basically all the test, and this is very easy compared to, if I'll compare with the medicine, very easy topic. Okay. So these many things we are going to complete in this chapter: organ or disease panels, drug testing, therapeutic drug assay, consultation pathology, urine analysis, molecular pathology, chemistry, anatomical pathology, cytopathology, cytogenetic studies, surgical pathology, and reproductive medicine. So it sounds very scientific, but don't worry, it's actually very easy. If you even if you don't know what is a consultation pathology, you will remember the course easily. So good to start. Okay. Sometime what happen? This course will be clubbed with this. This pathology course will be clubbed with this course. This is cardiovascular surgery part 36415, 416, 420, and 425. Just to obtain sample. This is for sampling. Okay, like how we are taking blood. Are we taking from our fingertip? Are we taking from the vein puncher? Are we taking from the other method? Okay, so that is a procedure to take blood sample only. In this again we will see few modifiers, which is 22, 26, 32, 52, 53, 59, 90, 91. So I'll come one by one on this modified. Okay, guys. For this topic, please be attentive and please respond. Okay. I know that this is an online class today, but don't only sit, because I will not knowing that if you are getting this topic or not. Otherwise, okay, you should be very attentive and respond in between, so that I'll also enjoy this class and you also. Fine. Otherwise, you know now the Bangalore weather. You will easily within 2 minutes you will sleep. Okay. I know how this online classes goes. Like I also attend meeting, na online meetings. So in meeting also, if I'll not respond, I'll be sleepy. So please don't be, and enjoy this topic. It's very interesting and easy one. So first we will go with the panels code. Panel, it means group. Okay. Panel, it means literal meaning is a group. So now we have, suppose this one code 80047. Now suppose if I'm going, I am not feeling good, doctor has ordered me one test. The test name is a BMP, or basic metabolic panel. Okay, sometime it will be referred as a BMP only. BMP, calcium ionized. So basic metabolic panels. I went to the laboratory. I asked your boss how much it is. They said 800 rupees. So 800 rupees one test. They said no sir, this is not a one test. Actually, this is group of 8 tests. You can count it. Calcium ionized one test, carbon dioxide second test, chloride third, creatinine fourth, fifth glucose, sixth potassium, seventh sodium, and eighth urea nitrogen test. So actually, this is a 8 test, individual test, and for each test is 100 rupees cost. We just grouped it. We are not writing 8 things separate. We'll just write one thing, BMP, or basic metabolic panel, just for our easy. Sounds good? So 8 tests, each test is 100 rupees. So the total cost of the 80047 is a 800. Okay, I was expecting you will answer. Okay, so nothing, no problem. So this is 800 rupees. Clear? This much clear?
Yes.
Good, Sambhavi. Fine. Similar way, you will see we have a, that was a 47, right? The other one is a 48. This is also basic metabolic panel. Can you find out the difference between 47 and 48? Everyone? Can you tell me, is it same or something different?
Different, sir.
You can see 48 also 8 test, 47 also 8 test. Urea, sodium, potassium, glucose, creatinine.
48.
Or 7 calcium ionized.
Correct. In a 47,
Ionized and total, sir.
correct. In a 47,
Calcium
we have a calcium ionized. And yes, and 48 we have a calcium total. Okay. So there are two types of a calcium test, calcium total and calcium ionized. In 48 we have a calcium total, in 47 we have a calcium ionized. Rest all 7 things are common. Okay, now it's very easy concept. Okay, I'll tell you the concept, and you have to write down some rules also for this. Or better, chalo, first write down. First write down the rules, and then we will go with the concept that based on the rule. Okay, first rule. Report all panel. Please write down in your book, and write down in your book only. Report all panel. Report all panel report a panel when all test is performed. Report a panel code if all test is performed. That would be your first rule. Report a panel code when all test is performed. It means when you will give 800 rupees when all 8 tests has been performed. Correct? Suppose doctor ordered this 8 test for 80047 along with glucose is also there, along with bilirubin. Bilirubin is from our liver test. Okay, is bilirubin is included here? Hmm? No, na?
No, sir.
So what if any additional test performed? You have to code it additionally. Okay, so come to the second rule. Achha, second rule will be from there. First rule you write down, right? Report a panel code when all test is performed. Second rule, if any test is missing from the panel, write down, if any test is missing from the panel, do not report a panel, report individual tests. Now what does it mean? If doctor has ordered BMP metabolic panel calcium ionized 80047, but they have not performed chloride, it should be 8 tests, right? But they have not performed chloride test. Will you still pay 800 rupees?
No.
No. How much you will pay then?
700.
700. Good. How do you know? How you will pay then? 700 rupees. How you will report it? In a medical coding, how you will report 700 rupees? Will you use any modifier 52, 53 or anything? 52 is for reduced service, right? If you will use 52 modifier, it will cut the payment half. From 800, it will directly come to 400. But you have to pay 700, na? Then how you can pay?
Code all the 7.
Correct. Except chloride, you have to code all other 7 code like 82330 for calcium ionized, for carbon dioxide 82374. Chloride has not performed, then creatinine code separate, glucose code separate, potassium, sodium, urea, nitrogen, all the code you have to code separately. Correct? That is how we can pay 700 rupees. Easy, na? So you have to pay only that much what has been ordered, what has been performed. If they have performed all tests, code a panel code. If they have performed less than all tests, code individual codes. That is second rule. Clear? Third rule, if any additional test, write down. Third rule, if any additional test performed which is not included in a panel, if any additional test performed which is not included in a panel, code it separate. Now suppose doctor has ordered 9 tests. These 8 from 80047 and bilirubin. So bilirubin is not included here. So for this 8, I can code 80047. And for bilirubin, I can add one extra code for the bilirubin. Clear? Clear, guys?
Yes, sir.
Yes, sir.
The next rule is very important. Write down. Do not report two or more panels code together. Do not report two or more panels together if any test is common. Do not report any two or more panels together if any test is common. What does it mean? Can I code 8047 and 80048 together?
No, sir.
If I want to code it together, then it means we are paying 7 tests extra, right? For 7 tests, which is carbon dioxide, chloride, creatinine, glucose, potassium, sodium, urea, nitrogen, we are paying double. And there is no uh, meaning if I am going for a same test twice in a day, right? If same test I am doing again, then there is no value on that.
निर्मल भाई भैया तो भाई ಸ್ವಲ್ಪ ಸೌಂಡ್ ಕಮ್ಮಿ रखो.
So how I can pay then? If they have performed, doctor has ordered calcium ionized also and calcium total also. Suppose your question says, doctor has ordered, suppose, na, this is why just imaginary one. Basic metabolic panel calcium ionized and basic metabolic panel calcium total. Both. Then what you are going to code? How you are going to code?
Sir, individual code.
Yeah, Gautam?
Individual code.
Individual code. How? Yeah, all ideas are welcome. Chalo, chalo, batao. How individual code? If they have they ordered basic metabolic panel calcium ionized and basic metabolic panel calcium total. So, as per the fourth rule, I cannot code 80047 and 80048 because there is a common factor, right? Common test. Then, can I code 80047 and 82310? One panel and one additional code. See down. Both are your answer. Means you can go with any code, any option. You can go with either 80047, 82310, or you can code 80048 and 82330. Please take a moment and look at this.
ନା ସତରେ ବର୍ଷା ହେଉଛି. ମୁଁ ତ ଶୋଇଛି ଉଠିକି ମୁହଁ କ'ଣ ଧୋଇକି ଦାନ୍ତ ମାନ୍ତ ଘଷି ଶୋଇଛି କାହିଁ. ବର୍ଷା ଯଦି କମିଲା ପ୍ୟାଣ୍ଟ ସାର୍ଟ ପିନ୍ଧିକି ପଳେଇବି.
Let me know what you have understood here. Anyone? Right, 1, 2, 3. And see what will be the value of these codes. One panel code 800 rupees, extra one code 100, it means total 900. So with any option, if you are going, it will be calculated as a 900 rupees. Right? It will come as a 900 rupees only. All good, guys?
Yes, sir.
Yes, sir.
Please let me.
Sir, not audible, sir.
So sorry, it was. I don't know how it was muted. It was mute. So what I told you was that please ask me question if you have any doubt, because that was a very easy panel. As we'll go further, the complexity will little increase. Now write down the final rule, which is rule number 5. Do not report modifier 51 and 52 with panel code. Done?
Modifier 52 and
51. 51 and 52. Okay. Now let's see this. Yeah, let's see this question panel 80051, which is electrolyte panel. See the blue color question. Electrolyte panels ordered for the sodium, potassium, and chloride test are performed. It means we have 400 rupees here. 80051 value is a 400 rupees because we have 4 codes. Okay, carbon dioxide, chloride, potassium, and sodium. But here they are saying in a blue color question, sodium, potassium, chloride test are ordered. It means they did not perform carbon dioxide. Can we code 80051?
no.
No, as per the rule, no. Can we add 52 modifier?
No.
Again, rule number 5, no. Then how we can add? How we can code? I can code each performed test separately. Individual codes, right? 84295, 84132, 82435. Clear?
Yes, sir.
Yes, sir.
Similar way you can check red color question, electrolyte panel 80051. Ordered sodium, potassium, chloride, carbon dioxide tests are performed. So they may give you like this, that these 4 codes, that 4 tests have been performed. You need to check whether it is coming under any combination or not. If yes, go with the combination 80051, and it's very easy to check. Go with the option. Check the option. Okay. See the third question, which is this orange color, electrolyte panels and albumin test additionally performed. Now you will see albumin is not included in a electrolyte panel 80051. So panel has been ordered. Okay, definitely we have to code panel code 80051. Then for albumin, we can use 82040 code separate. How do you know that is a code for albumin? You can see in a question book. And obviously there will be an option. Similar way, last question, electrolyte panels and basic metabolic panels, calcium, ionized ordered. How would you report this service? Now tell me the answer for this. The last one, electrolyte panels and basic metabolic panels. This one. Electrolyte panels and basic metabolic panels. And explain me how we can come to the conclusion.
Sir,
80047
Okay, why?
because all tests are including in there, it seems.
Very good. Because all tests are included in a BMP, basic metabolic panel, calcium ionized. Right? Carbon dioxide are there, chloride are there, potassium, sodium, all four are there already. So no need to report double. So I hope you enjoyed this one and you got the concept how we are going to code panel code. Okay.
yes, sir.
Previously, I used to give an example of a combo thali. If you're going to any restaurant or thali restaurant, you are asking a combo thali, which is very famous from that restaurant. Okay, they are charging 800 rupees for that thali. They said we will give you the delicious 8 items in that. So if you are getting 8 items, you are paying 800 rupees. One day you reached a little late. They said, "Arey, that one item is finished. Will you still pay 800 rupees? They are giving you 7. But will you pay 800 rupees? Obviously not, right? You will pay 700 on that. One item is finished. Right? Then the next example, suppose that they are giving 800 rupees, 8 items. But one thing you are missing, they have not given you your favorite sweets on this. But that sweet is available outside, means on the same restaurant. You asked for that sweet. They already told you that sir or ma'am, that sweet is not included in this meal. So you said, anyhow I have to eat that sweet, bill it separate. So 8 items you ate from that meal and one item extra you asked, which is for that you have to pay 100 rupees extra. Additional test. Clear? The fourth guideline, suppose there is 2 thalis on the two meal combo there. In that meal combo, 2 different meal combo, one item is common. One item is common. Now, if you are so hungry, you are very foodie. You will say, I want to taste everything here. So you will not order these 2 thalis together because there is a common thing. Right? You will not pay 800 plus 800, 1600 rupees for just to taste this thing. What you will say? You will say, exclude this, whatever the common thing is, whatever is the uncommon, bring it back. Bring it to me, I will pay for that. Right? Like BMP, basic metabolic panel, calcium ionized and calcium total. They will say, "Arey, sir, we have 2 very famous thalis from our restaurant." Then you realize the 7 items are common, only one is different. What you will say? Right? Give me that one separate one. I will pay only 900 rupees. For this example, this slide, mini thali and full thali. Mini thali only 4 things, full thali 8 things. You cannot order both things because mini thali, the items are exactly same, which is in a full one. Right? Okay. Can we code this 2 code together? 80061 and 80051.
Yes, sir.
Yes, sir.
Can we code? Can we code?
Yes, sir.
Yes,
There are
we can
different
code.
kind of-
Yeah, go on.
Sir,
There is nothing common between these two.
sir, doubt.
Yeah. Ask me somebody.
What if they ask for carbon dioxide, bicarbonate, chloride, potassium, sodium, and glucose? We can code 80051 and extra for glucose.
Correct.
Okay.
Okay. But make sure when you're coding 80051, you have to make sure that all four has been performed already.
Okay.
If they are asking you, I have performed carbon dioxide, chloride, potassium, and glucose, not sodium.
Then
Four tests, there also
separately.
four tests. So what you will do?
Then code all the four separate, individual.
Correct. All four separate. 82374, 82435, 84132, and glucose code.
Yes, sir. Okay.
Correct. See, glucose wala example. Then we have a comprehensive metabolic panel in which we have 14 tests. Can we report 80047 and 80053 together? If yes, then good. If no, then what we need to report?
Sir, no, sir.
Because there is a common thing, right? Always remember when they will ask you for two groups now, just check the both groups or both panels if there is any common thing. If yes, then definitely you cannot code these two codes together. Right. Now how to code this?
Only calcium ionized is missing in comprehensive metabolic panel. So we will code that one.
Right. Very good. So I can code 80053 and I can code 82330. Very good. So you all are good with the panels. These two panels we can code together.
No, sir. Because all are common, sir.
No, it's exactly same, right? It is included.
Sir, yes.
Great. So these are the things we have here. Remember these 5 rules which I told you. Okay, these two one. If both has been ordered, then what you will code? Give me answer.
Sir, 80053 plus this phosphorus inorganic separately.
Phosphorus inorganic phosphatase separate. Okay, I do not have answer here. Correct. 80053, and you can see albumin is common, calcium total is common, carbon dioxide is common, chloride is common, creatinine is common, glucose is common, potassium, sodium, and urea nitrogen. All this common except phosphorus inorganic phosphatase 84100. So you will code 80053 and 84100. Okay, which code we have to take as a panel, complete panel code? For that we have a guideline that you have to take the panel code which have the highest number of a code. Like, see, these are the rules, the same FTR which I told you. Okay, someone is raising hand. Yes, Nagendra. Acha, in this, why I am coding 80053 and 82330? Why I'm not coding 80047 and urea nitrogen is common. What is uncommon? Bilirubin. Okay. Can I code like this also 80047 and then bilirubin, which is not included in 47, and what else? Phosphatase alkaline, protein total. Can I code like that? Valuation will be same. Value or the amount will be same. But I cannot go like that because we have a guideline. You have to code the panel code which have the highest number of a code. That guideline you will get here. Do not report two or more panels code that includes any one of the constituent tests performed from the same patient collection. If a group of a test overlap two or more panels, report the panel that incorporates the greater number of a test to fulfill the code's definition and report the remaining tests using individual test codes. Clear? All good? Okay. The most important question from this panel is this one, 80055. Please come to this. This is OPS panel, obstetric panel. It means during pregnancy, they are going to check this thing. Okay, that is called OB or obstetrics during pregnancy. Now in that panel, we have a 7 test. Blood count, CBC, automated and automatic differential WBC is one. Then we have a hepatitis B. Third one is a rubella. Fourth one is a syphilis test. Syphilis is a STD. STD means sexually transmitted disease. Okay. Syphilis test can be performed by the two approach. One is a treponemal antibody. The other one is a non-treponemal antibody. So what you need to remember is that for this 80055 panel code, the syphilis test must be performed by the non-treponemal antibody. Okay? And what to remember is given there in a panel. Clear? But what usually question asked in exam is, what you will code OPS panel when the syphilis test has been performed with the treponemal antibody. See, non-treponemal is included. Just imagine you are going to the thali restaurant. Okay, they promised you 7 items. Okay, in that is a veg thali restaurant. The paneer is so famous, but one day the paneer is not there in that, and they replace it with the mushroom. Will you pay for the thali? How you will quote that one then? Here, if they have performed syphilis test with treponema antibody, how you will quote? Read down to that code description. You will get your answer and give me that answer.
Eight 6780 should be used for treponema antibody approach.
Okay. Okay, others? Same? Yes, Sakshi. Sakshi, Nagendra, you raise your hand. Any question? Then I have a question. Give me answer for that. How you will report? See down. When syphilis screening is performed using treponema antibody 86780, do not use 80055. Use the individual codes for the test performed in the ops panel. It means you will code 0.1, which may be 85025 or 85027, and 85004, along with hepatitis B 87340, along with antibody rubella 86762, and you will replace the number 4 code 86592 with 86780. Right? We cannot code 80055 because in a panel, if we are coding panel, it means the syphilis test has been performed as a non-treponemal. But in my question, the syphilis test has been performed with the treponemal, like this in a question. So you have to code each code separate, because for that we don't have any panel code. Clear?
Yes, sir. Yes, sir.
This is a very, very important question. Many times they have asked this one.
So option C.
Yes, option C is the correct answer.
Sir, then it won't be obstetric panel, right? Because of
Correct.
one.
It won't be obstetric panel. But although they may mention you in a question that ops panel has been ordered. Okay? It won't be ops panel, correct. Hmm. 23-year-old, 38 weeks pregnant patient arrives to the obstetrician for her weekly prenatal visit. The patient complains that she is experiencing increased fatigue and is unable to stay awake. The doctor orders general health and ops panel together. Tell me, can we code together? General panel, it means it must be 80050. Lo, chalo. Can we code these two code together?
No, sir.
No, there is some combination. The code we have, there is a combination. So 82255, correct? And then 80053 and 8444443. Is it correct answer? Code the panel code which is having the highest number or greater number of the code. That is 80055. Then what is the common? The common factor is a point number 1 only. Okay. Actually, there the answer will be this one only. Actually, the answer is this. Why not what I have wrote? Why not we are choosing 80055 and then point number 2 and point number 3? Why this must be answer? Although we can see in general health cam only there is 3 points, but in ops panel we have 7 points. Are we breaking our rule? See guys, both option will be there. What you will choose?
Sir, we should code highest panel code always, right, sir?
So why not we are using that 80055? That have the highest one, no?
Yes, sir.
Then
This is only for obstetric patient.
what Shakti?
This 80055 is specific for obstetric patient.
That is for ops panel. Guys, come on, if both options will be there, how you will do?
According to that guidelines, we'll go with this 80055, 80053, and 8443 only, sir. But
Correct. But why I'm saying this is the correct answer? Okay, guideline what says? Code the panel code which has the greater number of tests, correct?
yes,
Here if you'll see 80055 we have 7 tests. And 80050, how many tests we have?
3.
No. First test, blood test. Second, comprehensive metabolic panel. Not test. 80053 includes 12 tests. Similar way, thyroid stimulating hormone panel. That is okay. That is one test only. But you can see metabolic panel. Right? That is the reason we are using 80050. You got it?
Yes.
Yes, sir.
Because here it's a panel is included on this. I hope it is clear now. Okay, you may get sometime these many codes, okay, in a option. Don't worry. You just have to solve this one. It may not be answered, it may not be answered. That B and C. So 53-year-old patient with a history of elevated liver enzyme returns to her. primary care physician office for her routine annual physician. The physician ordered a comprehensive metabolic panel and hepatic functional panel. Can you check? Can we code both comprehensive metabolic panel and hepatic panel?
No.
No, na? Correct.
Yes, sir.
The answer will be D here. Okay, just go with the panels. Panels are done. Let me know if you have any doubt. Just see if you have a doubt, please let me know. Then we'll move to the drug testing, which is also another fun. Okay, done?
Yes, sir.
Any doubt?
No, sir.
No, na? Chalo. So let's go to the testing part. First, we'll come to the definitive drug. First, we'll come to the presumptive drug testing, then definitive drug testing. So now, what is the presumptive and what is the definitive drug testing? Okay. Have you ever done any in a chemistry lab? Have you done this testing? If you're from the science background in school, college, they must give you some chemicals, right? In school and college, in a chemistry lab, they will give some chemical and will tell The teacher will tell to find out what is the chemical, right? That is a testing. Similar way, I'll give you the easiest example. First one, in a weekend, okay, in a weekend time, in a Bangalore night time, if you're driving a bike or a car in the main streets, where the pubs and all we have, definitely cops is going to stop you and will check alcohol test, right? They have one machine. They will ask you to blow air on that. Your breathe. That is a breathe test. So they can find out whether you have consumed alcohol or not. One test. That is a screening. First test. Screening, or I can say presumptive. They are just presuming that you have consumed alcohol. Suppose that machine gives positive result, positive reading. Now you start arguing with the cops that I have not consumed anything. Your machine is wrong. You want to take penalty, unnecessary penalty from me. Okay, I am not going to give you. I will call my advocate, or I'll call my guardians or parents, anyone. Right, and you know your rights also. That maybe machine is not good. That is giving false reading. Then what is the another thing? What you can do? You cannot simply argue in the simply fight with the cops in the middle of the road. They will beat you, right? So what else we can do? As a legal right, we can go for the blood test. You're saying okay because the fine is now 10,000 rupees, right? For the drink and drive. So you don't want to pay 10,000 bucks. You just say okay, if you confirm that I consumed alcohol, let's go for the blood test. Blood test will give you confirmatory result whether I have consumed alcohol or not. Because you are so confident that no, I never touched alcohol. That blood test will be considered as a now confirmatory test or a definitive test. Clear? So test will always be two types. First is a presumptive. Second will be definitive. See this. Presumptive identifies the patient is using a drug or not. Presence or absence of the drug. You know, there are in an athlete competition, right? Many drugs are prohibited. You cannot consume any drugs which can enhance your stamina or your performance in a ground, right? That is why that test is known as a dope test. You have to go through with the doping test or dope test. They will confirm whether you have consumed any prohibited drugs or not. If yes, then definitely they will go for the confirmatory test before banning you. The first presumptive test is identifies if the patient is using a drugs or not, presence or absence of a drug. It will give only quality of the test, not quantity. But if I'm coming to the definitive drug or confirmatory drug testing, it will confirm the drug and also quantifies the amount. It may be quantitative and it may be qualitative. Good. Another test we have that is known as a therapeutic drug assay. Assay means examination. Okay. So therapeutic at its name itself says therapy. So it is for therapy. We already know that patient is taking their drugs for some disease. Now I want to check how much drug is absorbed in his body. Like if you know about the medicines, the tablet or capsule, whatever you are taking, the entire amount is not absorbed in your blood. Some amount will be bypassed by your liver. Some amount will be bypassed from your intestine. And that is why they said IV, if patient is having a so high fever, then we'll not give paracetamol tablet, we'll give injection only. Because it will take time for the tablet to dissolve in our stomach, and then half of the drug only will come to the blood. So better directly given a blood as a form of an injection. Okay. So therapeutic drug is only and only for clinical response of the known drug or prescribed drug. So let's come to the presumptive, also known as screening and preliminary. I will share the slide to you. Okay. We have three drugs only, three CPT only. 80305, 306 and 307. Now 80305 is very simple method where the experiment will be carried out by the human being and the result also will be calculated by the human being. Okay, performed by the human and results also depends on the human. You can see drug test, presumptive, any number of drug class, any number of devices or procedure capable of being read by direct optical observation only. We don't need any machine for this. That is 80305. 306 performed by a human being, but for result we have to depend on the machine, read by instruments. Instrument assisted direct optical observation. Highlight instrument only. Third one, performed by machine, read by machine. Like if you are washing your clothes by your hand, right? Washing cloth by your hand, drying it by your hand. That is 80305. 306, if you are using semi-automatic washing machine, washed by machine, but again you have to you have to move that cloth, washed cloths into drying chamber. So you are also doing something, although it's done by machine, but human effort also needed. 306. 307, fully automatic washing machine. You don't need anything. We'll just switch on the machine. It will automatically switch off when it will be done. Okay. So 305, 306, 307. Best example if I'll give for 305 is a pregnancy kit. You might have seen that advertisement, that one small kit, Prega News or some other brand names, it comes where lady, if she is suspecting pregnancy, she has to drop 2 drops of urine only. The morning urine. 2 drops of urine, 1 line, no pregnant, 2 line, pregnancy. We don't need any machine for that. To perform the test, we don't need any machine for result. Right? So that is a dipstick, cups and cards. If you are from the science background, you must be knowing that HPLC. HPLC, high performance liquid chromatography. The name will be given in your book. If you will come to definition and acronyms conversion listing, just after the presumptive test drug assay, you will see the full form or full name of the ELISA, ELISA, EMIT, FPA, IA, KIMS, RIA, okay, GC, HPLC. You will get full name on that. So HPLC is what? It is a big machine where the drug or any that chemical what we are going to test We have to just inject it manually. That's all. Remaining, the test will be performed by the machine. The result also will be performed by the machine only. So HPLC, ELISA, immunoassay. This is enzyme-linked immunosorbate assay. Okay. This all are a big things. MS, mass spectroscopy, GC, gas chromatography. Clear? Good? Not good? Right? Are we good on this?
Yes.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir. Right?
Yes, sir.
Okay. One thing you need to write down. Just write down on the top of your book. Do not multiply 305, 306, 307. Means you cannot code more than one for one day. Because you can see at the end, once per day service. In all these three, it says per day service. You cannot combine, you cannot multiply this thing. Like in this question, you can see presumptive drug screening for the barbiturates, opiates, and antidepressant using ELISA. Although they are using 3 drugs, but still you have to code 307 only, not 307 into 3. Because if you read 305 from starting, it says any number of a drug class, any number of a device or procedure. Good? Done? Please write down. That is very important. Do not multiply these codes for a single day. If they're asking you, one day we have performed ELISA, second day we have performed 306, or 2 ELISA, one day one ELISA, second day second ELISA. What you will code for both days? Then you can code for 2 codes. But that is very rare condition. See down 305, 6, and 7 once, irrespective of a number of drug class, procedures, or result on any date of service. Clear? Now come to definitive drug class listing. It is very easy now. You can just come to the definitive drug class testing. The code starts from 80320. You will see numbers of a codes. It's the easiest thing in this book, in this chapter. You just have to go to the codes and check whether the code is for the particular drug or not. See, cocaine, fentanyl, gabapentin, methadone, opiates, oxycodone, opiates 80362, 361, 362, 363. Opiate, one or more is a 361. Opioids 362, 1 or 2, 3 or 4, 363, 364, 5 or more. So number of drugs also depends on the codes. If I'll ask you, this. Okay, this is a therapeutic one. Okay. What is sometime important? Not sometime. It's challenging is that sometime you will not get the drug name here. This all whatever is given is a class name. Opiates, opioids. These are the class of a drug, not particular drug name. Sometime in a question they will ask you drug name. Like they can ask you for suppose codeine. They will ask you what is the code for codeine. You will not see here. Here we have cocaine. Cocaine is different. That same cocaine which drugs, narcotic drugs. Okay, small amount we can use for medicine also. Okay, but I ask you codeine. Where is codeine, guys? Can you find out in these drugs? Yes, no? Is it given?
No.
No, right? So where you will get that one? Definitely you have to get it. So you can come to this part, which is just next to this page. And you can see 80361 opiates. Opiate is a class of a drug. Inside that, we have a codeine. Codeine, dihydrocodeine, hydrocodone, hydromorphone, morphine. Okay. So simple, you have to go check all the codes which is given in an option. Go with all option. If it is a directly leading, no, it is not directly leading. Come to this definitive drug class listing table and find out if it is given there or not. If not, I'll tell you what to do. But most of the time, 99% things, 99% time you will get your drug's name here. Like if I'll ask you here, what is the code for zolpidem? You will not get in the here. You will not get zolpidem here. But if I say you, yeah, zolpidem is a name of a drug which is coming under sedatives hypnotic. How do I know? 80362 code. Drug class is a sedative hypnotic. Drug name is a isopiclone, zaleplanon, and zolpidem. Yes.
Yes, sir.
Same thing we have for therapeutic also. For therapeutic, so we don't have even a table. The only difference between the definitive and therapeutic, definitive we are confirming drug, that what drug they have taken or consumed. Therapeutic, we already know what is a drug because that drug has been used for the treatment part. We are just just checking that how much drug is absorbed in the body. Okay, like if I'll tell you this question, can you say this question? The patient used topiramate to control his seizure. He comes in every 2 months to have a therapeutic drug testing performed to access serum plasma levels in the medication. Can you tell me what is the answer for this question?
So 80201.
80201. Is it? Is it for topiramate?
Yes, sir.
I need to check that one. You check, guys, it is correct or not. I think it's correct one.
Yes, correct, sir. Copy on.
Yeah, 201 is the correct answer. Done. That's done. Can we solve this question? 305, 6 or 7 or 306, 80365. Check. 33-year-old female arrives to the ED for injury sustained resulting from a motorcycle accident. The ED physician suspects the patient is under the influence of the controlled substance. The physician orders blood screening to affirm or disapprove his suspicion. Doctor is just suspecting the patient having some drugs. So to make sure or to check it, the doctor has ordered blood screen test. The laboratory performed the enzyme-linked immunosorbent assay and reported the presence of the drug in the patient's system. Now tell me, it's a 305, 6 or 7.
ଧଳା ଧଳା ବିକ୍ରି ହୁଏ ନା ସେ ବଏଲର ଦୋକାନରେ ବିକ୍ରି ହୁଏ ନା ହଁ ସେଇ
7.
How do you know that?
Used enzyme linked immunoabsorbent assay.
Yes, laboratory assessment. Yes.
Yes, that is enzyme linked immunosorbent assay is nothing but a ELISA. How do I know? I have checked that page, and right, I told you that there we have a full form of ELISA. Sometimes they will give you like this, na? Gas chromatography or high performance liquid chromatography. Okay, you can simply go and check. So this is 307. That's correct answer. This one, I'll tell you how to use 91 modifier. Then we can go on that. Okay, this one. This is very, very easy. Okay, which option is not correct?
A, B, C.
That's good. Done. A, B, C is not correct. Because we cannot multiply those codes. So D is the correct answer. That's done, guys. Okay, so this is done for your panels as well as drug classes. Okay, presumptive, definitive, therapeutic. Similar way, we have a chemistry and microbiology also. Molecular, so I will tell you. Okay. Now, next week, we will go with the consultation and other parts, the urine analysis and all. Make sure to solve the medicine question paper because next week we will discuss that one. And one more thing, on Thursday, okay, please remind me to share answer for medicine question paper. Thursday, Friday, any day before Saturday. Mostly Thursday because you can then check your answers by Friday. You have 1 week time to solve the question paper. Please do that. And then we'll have a discussion on this. Okay? All good?
Yes, sir.
Great. Then see you next week, guys. If you have any doubt, please